Welcome to Voices in Health and Wellness. This is the podcast where we explore what care looks like when it's reimagined by those who dare to ask deeper questions. Today I'm joined by Dr Ivan Cichowicz, a board-certified adult and geriatric psychiatrist based in Florida. Ivan is the co-founder of Mindful Behavioural Health, an outpatient psychiatric service practice focused on adult and geriatric mental health. He's also a primary investigator in brain health research at Cognivita Brain Health. So with that, Ivan, I'd like to welcome you to the show. Thank you very much for joining me today.
Oh, thank you, Dr. Greenland, for having me on. I really appreciate the opportunity to just talk to you about all this stuff.
Wonderful. So perhaps we could start at the top, talk a bit about your journey, if we will, because I know you're wearing a few hats right now between your outpatient practice, research at Cognivita, and launching a new dementia education platform. Can you kind of walk us through how all this fits together in your world?
So I started as an outpatient psychiatrist with love for geriatrics, and little by little, my patient population, I think just because I'm here in Florida, the capital of retirement, um, ended up seeing a lot of patients with a lot of cognitive disorders. And it was always trying to figure out, what to do and how to incorporate that and how hard it was to just kind of get the whole system to be able to support these patients. And this is how kind of we ended up here. Ended up shifting from more traditional just depression, anxiety kind of therapy treatments to more underlying cognitive issues. And I'll use an example of the psychiatrists that I know and of the psychiatrists that I work with. A lot of times, if there's cognitive issues, a lot of them are like, I don't feel comfortable. I don't want to deal with it. And was trying to figure out how can we help more people. And this is how we've started to incorporate all these things from being more involved with Cognitiva, which we're trying to create an online community where we can help educate, teach, um, about everything that's changing in brain health and cognitive disorders now, and then just trying to incorporate more of, I'll use the word kind of brain health and cognitive health into our practice.
Got it. And maybe you to rewind a little bit, talk about your kind of journey into this whole world from the outset, because it's always interesting to hear how people have ended up doing the work that they do and the specialism they choose. What kind of inspired this whole journey?
So when I was in medical school, I remember I rotated with in the PM&R or psychiatry department because I had an interest in that. But I quickly learned that I didn't enjoy working with athletes as much as I thought I was, and I really enjoyed working with the geriatric population that was just getting physical therapy. So fast forward to psychiatry residency, and just out of coincidence, out of the 4 years of psychiatry residency, on 3 of those years, my supervisors were geriatric psychiatrists. So I just spent a lot of time surrounded by geriatric psychiatry and talking about it and being invited to geriatric psychiatry related stuff. And it just sparked a big interest. And the other part here is, I love a challenge. And what is more challenging than trying to figure out not only the brain, but dementia, which has been so hard to treat? So this is kind of how I ended up here. And then, of course, more recently, just frustrated because trying to figure out what to do, how to help these patients, and are exposed to people like Dr. Bredesen and his like protocols for cognitive disorders, and that just opened the whole new world of opportunities, and we've started to incorporate a lot of his ideas and teachings into like our practice and just started having very good results, which just kind of, I'll use the word, makes you even more motivated to continue working on all these, I'll say, lifestyle interventions or I'll say like integrative kind of like mental health and how it's a big part of the picture that we just weren't focusing on.
Got it. We'll come back to Dr. Bredesen's work in a moment because I'm a Bredesen person myself, and I think it's one of our kind of common interests. So we'll definitely delve into that a little bit. But could you tell us how your week looks these days? I mean, what does a typical week look like? And I guess there is no such thing as a typical week. But I'm just curious to know how all these pieces fit together in the big jigsaw puzzle of your world.
So right now it's about 4 days of, I'll use the word traditional clinical practice. So it's seeing patients face to face, some of it online. And then one day a week, I'm focusing on building our, I'm going to say, dementia education platform and dementia education program. I mean, research is just always there in the background. It's integrated into like the day to day. So this afternoon, I'm here. After this, I'm just doing an eval for one of our research patients. But the gist of it is really that clinical practice component. And that's just, I'm going to say, from the time you wake up to the time you go to bed, this is what we're mostly doing.
Got it. Now, you mentioned that many dementia patients come to you with mental health symptoms, even though their neurologists are prescribing the donepezil and memantine and telling them there's nothing else to do. How are you trying to shift that conversation? Because this is part of my world as well. I'm seeing dementia patients on these drugs, but I'm very curious to hear your take on this.
I mean, so the classic patient here who I see is someone who was told by the neurologist or the primary care doctor, there's nothing you can do. Take this medicines. They pat them on the back and they say, I see you in a year. And of course, this causes a lot of like anxiety, distress. Your ego is like, what the heck is, my future? And a lot of my patients say, look, I've waited all my life for retirement and now I'm here and I'm told I have dementia and there's nothing we can do. So a lot of them come into the practice for two reasons. One, they're extremely anxious and overwhelmed, and they're just looking, I'll use the word for an outlet. And two, sometimes the neurologists and the primary care docs just don't know what else to do for these people. And they're like, oh, why don't you go see, Dr. Cichowicz? He does a lot of dementia work, kind of thinking, well, he'll help calm them down, he'll listen to them, he'll talk to them. So this is how I started getting, I'll use the word people coming my way. And now what we do is when they come in, we tell them, look, we're not promising anyone cures or anything along those lines, but we are saying with some work and some effort and some lifestyle modifications, we can actually help make your quality of life significantly better. And I want to clarify, I'm still an advocate for medicines. I'm not going to tell someone, just don't take medications for any X or Y reason. No, I think when you have an illness, you want to do everything that you can to cure it, but we always want to look at the risk and the benefits of what we're doing. And I'll use the word lifestyle modification really has very little risk to it.
So, in terms of the kind of the different things that you do for them, I mean, you mentioned about the anxiety and the stress that come with the diagnosis, and this kind of take the medicine and disappear into the sunset and come back. What else are you doing with them specifically to help them through?
I mean, so number one of all of this, it's education. It's just helping patients understand exactly what they have, what does that mean, and what the most recent science says about what we can do and what we can't do. And education is important in two ways. One, it helps people understand what's going on. But number two, it also helps them avoid being caught up in all these, I'll use the word like online scams that are out there nowadays. Because I see so many of my patients who say, look, I've signed up for this or I, paid for that. And it's like, look, none of that stuff is where you want to be putting your energy on. Let's put your energy on what we know can make a difference. And we're talking about, exercise, sleep, healthy eating. And these things are going to provide much more bigger bang for your buck than any quick online fix. And hey, I'm a fan of some supplements. I am a fan of some of the technology out there. And I think technology keeps you engaged and can keep you coming back to the things that really help. But there's so much quick fixes, do this, take this, and you're going to be cured. That, uh, again, it's a struggle because a lot of our patients get taken advantage of. They're desperate.
I hear you. So, the Bredesen thing is a commonality that we have, and in my world, I'm working at it from kind of a functional medicine perspective, an integrated medicine perspective. It's a programmatic, for those people who don't know, it's a programmatic approach to optimizing brain health. So you've talked about some of the approaches that you have. How do you cover off all the other things that Dr. Bredesen would like people to do to optimize their brain health?
I mean, so in all honesty, we, I'll use the word, don't have the maybe ability to do the full Bredesen protocol with everyone. But what we tell people is this exists, and it's not about being perfect. It's the more things we can do, the better chances you have. Okay, so and a good example is some of the Bredesen protocols is, let's say, with ketosis. So I'm not going to give someone a hard time if they're struggling, but I'll try to get them, look, 1 week a month. Let's try to get you there. And let's see if you can do 1 week a month, then the rest of the time, it's okay. And little by little, because they see that there's improvement, it's easier for me to get them to say, well, I'm going to do like, 2 weeks or 10 days. And from there, I can get them to do 3 weeks and 4 weeks. And it's the same thing with exercise. And I think these are the lower hanging fruits. And once I get results there, then I can talk to them about more complicated things that a lot of them say, oh, that's a big effort. Like, having their house checked for mold, um, you know, checking if they have sleep apnea, because a lot of times patients are resistant to this. There's like, that's not going to make a difference. So I try to start with the simpler things that I feel patients can just start to feel better pretty quickly. And to me, those two things are exercise and diet.
In your experience, what are the things that patients find most challenging to do on the protocol that you've kind of picked up on?
I mean, so number one is, I'll use the word, the buy-in. So there's two types of patients. Patients who are, you explain this to them and they go out, they buy the books, they read them, and they literally start tackling everything at once. Um, and those are easy, though I worry about burnout because they're trying to do a lot all of the time. And then the patients who kind of say, oh, that sounds like amazing, but don't do anything. So I find that sometimes it's the anxiety about what if it doesn't work, or the anxiety about what if I can't do the things that I have to do to get better, because they'll come back to, but is there not a pill that I can take that makes it better? Because that's easy, it's straightforward, you don't have to put an effort. So the real challenge is convincing people that if we change how you deal with your life, you can get better, and explain to them why. So if we can bring down inflammation in your body, that's going to be good for your brain. And even though we can't say that that's going to cure your cognitive issues, it's going to make your cognitive function better. So even if we bring down inflammation 10%, I try to tell them, you're going to be 10% better. And the more that we work on that, the better that you're going to get. So the bigger challenge is that first step. I think once they start doing the steps, they start to notice that there is improvement in how they feel. And and the other challenge is sometimes getting buy-in from family, because sometimes the patient is like, I want to do it, but then they tell me, look, my significant other still, wants to have donuts every morning for breakfast, and it makes it hard on me to kind of say no. So it's I'm gonna say usually about a month to a month and a half of, I'll use the word, kind of behind the scenes work of trying to push people and educate them and showing them, you know, information and talking about other patients who've had success until we can, I'll use the word, kind of get them there. And then once they start following up, then they can start feeling better, and then they'll say like, oh, I'm gonna go see if I can find a dentist who can help remove like any like old fillings that I have in my mouth. But I usually feel that it works best when we start like a little bit at a time.
I hear you. Now, you just mentioned buy-in, which is really, really important. What about the reverse situation where a lot of patients are often brought in by their relatives, and actually trying to get the buy-in from the patient can be the challenge because they've kind of been brought there, not necessarily a willing partner, but sometimes there's a bit more resistance.
So the one thing that I found is when the patients don't come in, it's that they're brought in by their family. The easiest place to start is with modifying diet. And the way we address this is by convincing the family member who brought them in to just say, look, we're just not going to do pancakes for breakfast anymore. We're going to, have eggs or, avocados, whatever it is, and trying to just start there, because it can be very hard for someone who has, I'm going to use the word like either mild dementia, because usually when they have NCI, I can talk people into this without too much, I'm going to say, back and forth. But when they have mild dementia, they're usually more at the, like, what's the use? I'm just going to eat ice cream all day, or I'm just going to watch whatever news channel they like, or watch, Netflix. So those can be very challenging. And this is where family, again, can be just super useful, because if the significant other says we're going out for a walk, they'll usually kind of like go out for a walk, or I made arrangements with the neighbors to go out for dinner. Works a whole lot better when they're here telling me you have to convince the patient that he needs to call his friends and talk about his week. That is just very hard to do. It's a matter of convincing family to help facilitate some of these things.
Yeah, no, I hear you. I share exactly the same experiences myself. That's why it's so interesting talking to you as a fellow Bredesen person. And what's your kind of take on the patients that come in on the drugs, and how do you frame that? Because I think a lot of patients sometimes think, well, the Bredesen protocol is an alternative to the drugs. They want to stop taking them. How do you kind of have that conversation with patients, and what's your kind of take on them?
So the way I look at it is, look, you know, everything working together can be extremely helpful. And if you're on the medicines and you want to stay on the medicines, that is perfectly fine. If you're on the medicines and you don't want to take the medicines anymore, I kind of tell them that can be our goal, but in order to get to that goal, we need to do some of the work behind, these Bredesen protocols so we can get there. So it's kind of like, if you put in the effort now, we can then work on getting you off the medicine. I guess my bigger challenge, to be honest, Andrew, is because we work as a lot of times as a collective. So these patients see me, they see the neurologist, they see their primary. My apprehension sometimes with messing too much with these medicines is it causes distress and anxiety in some of the other docs. So as long as these medicines are not causing distress and the patient doesn't have an issue, I would rather leave them where they are and just work on, like you said, this more integrative or like Bredesen protocol type of way of managing symptoms than trying to tell them, look, this is better than the medicine or worse, because I don't want them going back to the neurologist and getting into arguments about what you did, what you didn't do. It just, then the patient care gets a little bit more fragmented.
Do you have any sense of the kind of patients that tend to do well on the protocol from your experience and your kind of observations of seeing individual patients playing out their own kind of case studies?
So at this point, I'm going to say, like, the people who really, really do the best are the people who have any degree of motivation. And when I have someone who comes in saying, I have a friend, a family member who was seeing you, and I know you changed some things, and they're doing better, and I can see it, I think those people do really well. Because again, they're motivated, they're willing to put in the work. Those people do really well. Um, and not only, to be honest, in patients who have dementia, but sometimes even in patients who have depression and anxiety, following basically kind of the same protocol, though, people will get better also. And this is why I think this is so powerful. If you treat your body better, your brain is going to work better. The hardest part is the motivation and the buy-in. So I'm going to say the more motivated you are, the better you work, because it's so much more effective if you, I'll use the word, like, do significant changes to your diet than if you just eat one less donut every day. When you eat one less donut, you're not going to notice a big difference. And I get it, some people need to start there, but when you can significantly change diet, exercise, social connections, I mean, these things make a big difference. When my patients say, like, yeah, now that I'm going out twice a week, I actually kind of look forward to stuff, and being out of the house, I enjoy things.
I agree. I think my observations are very similar. It's so gratifying hearing it from your side. Obviously, you're in a different country to me, which makes this interesting. You've mentioned about the team. This kind of is a team sport, really. You've mentioned the kind of interplay between you, the psychiatrist, and as you, the psychiatrist, the neurologist, and the primary. How does that work out? And how do we get good kind of team dynamics in managing these patients?
So I think the best thing that has happened, I'll use the word on my end, is there's an endocrinologist in the area who is also very well educated in these protocols, and we can always work together with patients. So that part is, I'll use the word, very rewarding and satisfying. And then also, because of where I'm located, there's I'll use the word, there's a lot of direct primary care, which is more a lifestyle modifications, more holistic, more disease prevention. And working with these docs is a little bit easier. The bigger problem is when you run into, I'll use the word, the big corporate medical structure, um, because they just don't have time to like engage on this stuff. It's more like, I don't want to hear, any of that. That's nonsense. Just take your medicines and, see you in a month. And that does create sometimes a little bit of a challenge. The big positive is I think things are changing for the better.
That's
And,
really good to see. Sorry, carry on.
and particularly with dementia, because I feel a lot of patients, there are on all these medicines, and I mean, they're not really that much better. And I have seen patients do much better on medication. This is why I don't want to diss the medicine in any way. I have seen patients improve, but long term, they still struggle with symptoms. So we need to have other alternatives than just say, we're going to help you for a little bit and then, pat on the back, just come in once a year and we'll document that you're getting worse.
Yeah. So I guess I don't know how far down the disease process a lot of the patients that you're seeing are, but what role do you see for early intervention, or if not even prevention, and lifestyle education playing in the future of dementia care?
I mean, so I think the future is in prevention. This is one of those diseases that, if you ask me, the best way to treat it is by never letting it kind of get a hold in the first place. And this is where, again, big fan of, like I said, diet and exercise, but sleep. Sleep just becomes a very, very important part of dementia prevention. When we're sleeping is when our brain is kind of clearing all the amyloid, kind of like plaque, out of our brain. Um, so I think prevention is just super important. I'm also like a big fan of these new studies for lithium orotate, used as a supplement to help. Again, not that this is gonna cure someone who has, like, I'm gonna say Alzheimer's, but it just can make a big difference in brain health from everything that I've read. So doing these things is, I'm gonna say, almost more important than treating people. And what I mean by that is because there's millions of people who we can help if we just get them to be a little bit healthier, and they don't have to worry about, do we have new treatments in the future? If you never end up having the disease, that's not a concern to begin with.
I mean, do you feel, obviously, wider than just dementia, which is what we've been talking about mainly today, do you think the field of psychiatry is shifting more towards functional integrative approaches in some of the other conditions, or is it still quite fringe?
I mean, I'll use the word, it is still a little fringe, but there's a lot, coming out in terms of functional medicine. There's a recent study now with the keto diet for schizophrenia. And the results, again, we're not talking about curing disease, but we're talking about patients doing a whole lot better. And these are patients who are extremely sick and have significant issues interacting in society. So whatever we can do to move that needle in the right direction makes a big difference. And when you can see that there's improvement in an illness that is so hard on the brain like schizophrenia, you can just put that together with any illness of the brain will likely have improvement with ketogenic profiles. Now, there's a lot of studies. There was a recent profile for treating depression, and the difference in depression with ketogenic diet versus normal diet was not that significant. But but again, I don't want to just say because you didn't see a huge change in one study, it means nothing, because we've had other studies that have shown big change. And what we're talking about is we don't really know what depression is. Depression is a bunch of symptoms, and they could be caused by a bunch of different things. Just like swollen legs, could be caused by a bunch of different medical conditions. And the question is, are there one of these types of depression that just respond more to metabolic changes than others? And because we don't still know which one is which, I'm a big fan of treating all as if they were. And that way we're making people healthier in general. Um, the Bredesen team just recently came out with their paper on their recent trial. I was listening to one of their YouTube discussions. And I think one of the interesting things, which I do see a lot here in my practice, is that not only were people saying that their cognitive function was better, but they have less joint pains. Their diabetes medicine got, cut in half or completely removed. Their blood pressure is better. And I'll use the word, just puts a smile on your face when you're like, there you go. Not only are you better from a cognitive point of view, but now you don't have to take those 3 diabetes medicines every day. Um, because this is kind of what we're here for, to kind of like, it's not just load people up with medicines, it's help them live better lives. Um, so I think this is the other like rewarding part of this and why it's important, even if it doesn't, again, if it doesn't cure everything.
Agreed. And I always tell patients it's not just a program to help with their brain health, it is a more holistic approach to their overall health. And it's not a bad program for anybody, regardless of whether you have dementia. If you actually look at the different pillars, it's actually a very sensible, holistic health plan for, longevity and vitality and long life. So I think it's a great program. Now tell us a bit about your education platform that's either in the pipeline or I don't know where you are with it, but just tell us a little bit about what you're working on.
So it's in the pipeline. I'm hoping to be ready around April, but the idea is we're kind of making it in, I'll use the word 12, we call it little pillars where people can focus on. And we're trying to get people to focus on one area at a time so it doesn't become too overwhelming. And it's going to be educational videos and support groups. So the idea is, because lifestyle modification is hard, if we can support people and make them part of a community, then they can push each other and help each other and just make this whole change in lifestyle almost like, I'm going to say, like a family plan as opposed to like an individual endeavor. And, and all this came out because, I keep looking at studies, and the problem with a lot of these studies is people who get education don't do better because they can't incorporate that education into their daily life, or they do it for 2 or 3 weeks and then they're done. The people who do better are the people who get education and support. But not everyone can afford to have a nutritionist or a dietitian, to have a personal trainer, to have a doctor monitoring how they sleep. So if we can educate a group of people and then unleash those people onto each other and have them support, and now with, the internet and all these LLMs, everyone can learn more and say, hey, you're struggling with this. I found this out. And then the MDs, we can just be in the background making sure that the information provided is accurate, clarifying if things come up that are not correct, and just pushing people day by day to like incorporate this stuff into their life. So that's the kind of the whole idea. And then we're trying to make it a little bit, I'm going to use the word more cool, by trying to incorporate technology into it and educating people about, different apps that they can use to track things, different devices that can let them know if their sleep quality is better or not, and again, and just try to stimulate people to be able to, I'll use the word, kind of compete against each other and show each other what their progress is.
Well, I certainly wish you all the best with that project. Very happy to put it on the bio page when it's ready to go to promote it. Sounds like a really good piece of work. So, and it's coming up. April is not far off. So
yeah, not far off. So we're kind of like scrambling with everything right now.
So as we both know, doing the clinical work is one thing, but building sustainable systems around it, that's another challenge entirely. So from a business perspective, clinic perspective, what's working really well for you in the work that you do?
So I'm going to say everything that is dementia related is doing really well. Now, I acknowledge I'm, in South Florida, which is kind of the retirement capital of the world. So there is a lot of interest and a lot of need in everything that is dementia related. The bigger challenge is, one, how do we get in front of patients? Because doing functional medicine, functional psychiatry, like if I see 12 patients in a day, it's a busy day. I don't do these 40 or 50 patients a day, so that means I can't really help a bunch of people. And also, my patients need a lot of support. I don't just meet with them, give them a bunch of handouts and a plan and send them home. No, I'll meet with them again, in 2 weeks maybe, and then in another 2 weeks. And then once they're settled in and they feel that they're doing better, we'll maybe meet once a month or once every 3 months. So the big challenge is, how do we make it so we can have people, or we can have enough people getting help? And I try to talk to other doctors, but a lot of them just don't want to touch anything that has to do with dementia with like a 10-foot pole. They're like, that's, you know, overwhelming, complicated. I don't want to go there. And this is where kind of cognitiva came up, when we're trying to figure out how can we address the situation, because my worst online reviews are from people who call and they say, the next appointment is in like 6 months. What do they think, that I have 6 months to wait? But I don't have a good solution for that. So hopefully this will help.
Just tell us a little bit about Cognitive again, if you wouldn't mind.
So again, it's going to be an online platform. We're going to do education. We're going to do groups where we support people with cognitive disorders, caregivers, just, I'm going to say, bring longevity seekers, education, support, and then we're going to try to create an online community for everyone to push each other and almost, I'll use the word, kind of gamify it, so you're always motivated to come back and show what your progress has been.
Got it. Okay. So that will hopefully help with the scaling thing. But apart from the scaling and reaching more people, what are some of the other challenges in running the business, the practice, and the work that you do?
So the other part that always, is an issue is the traditional American healthcare system, and the functional medicine system. The way medicine works is, it's fee for service. So basically, the way to make money is to see the most amount of patients in the less amount of time. And whenever you try to break that model, it's always going to be hard. Number one, it's the finances, again, are not as good as if you just see volume. You can move to cash, but then of course you are only helping a small segment of the population. And to make it even more complicated, so some of the things that I really like to do is I like to do cognitive batteries. So I know where people are when they're starting. We can do them a few months later, we can do them 6 months later, we can do them a year later, and we can actually show people, regardless of if you feel that things are better, worse, or the same, we have objective measures of what's going on with cognitive functioning. Um, but a lot of the stuff is just not covered by insurance or payers. In order for it to be covered, it just, like, you need to have recently had a TBI or had a stroke, or there just needs to be so much information in those notes that we can't get this stuff approved. So we tell patients, look, we're selling it at the lowest, I'll use the word, like, price that we can manage, but it's still frustrating when someone says, I'm not able to afford this, and therefore we don't have an actual marker of where we're at. And my thing is, I like many mental status exams, I like the MOCA, but you have to have like cognitive issues that are significant for that to show up. If you're just worried because cognition is not as good as it used to be, but you're not, I'll use the word, bad, we can miss a lot of stuff just because we're not doing the right, I'll use the word, the right testing or the right screening. And those are the screens where we kind of struggle. So I like, the Creo system, the CNS vital signs. These are like amazing platforms. It's not as easy to get insurance companies to agree that these are great ideas. So that's always the hardest part, you know, trying to mix in good treatments with what I would say not making financially burdensome on patients.
Got it. So what for you is the biggest time drain in all the things that you do? If you had to kind of specify, what would they be?
So there's two time drains. One I really enjoy, and this is, I'll use the word, learning about this all new aspect of health that we really kind of like never focused on when we were in medical school. So this is, listening to podcasts just like yours. It's reading books. It's, I'm going to say even social media, LinkedIn. There's just so much information out there. It is time consuming. And I get why some people say, like, I just don't want to be bothered because it does take away from, other things that you could be doing. So that is a time drain, but it's a nice time drain. The, the other, I'll use the word negative time drain is, again, it's managing when you come up against the system and all the time it takes to work this. So easy examples is trying to get visits covered that all that we did was functional medicine. Insurance will sometimes look at the chart and say, oh, I'm not paying for that. There was no prescription like provided, and you're trying to remind the insurance that psychiatry is more than just writing a prescription. I've had situations where insurance companies just deny bills because it's dementia. Psychiatry shouldn't be treating dementia. And it's trying to remind them, well, but I'm a geriatric psychiatrist. This is literally what I do most of the day, treat behavioral issues in dementia. Um, so that pushback is the part that is a lot of times the most frustrating when you're a geriatric psychiatrist and you get an insurance saying, there's no need for you to be treating anyone with dementia. Um, if you change the diagnosis to, mental health primarily, we'll be happy to pay.
Thank you. Obviously, you've got your platform about to launch at some point. Now, I suppose, what would happen if you had a sudden influx of 10 times more interest in your services as a result of the success of your endeavours and your platforms? What would actually happen?
So my actual goal is that if we're successful, I will be able to leverage that success to get other psychiatrists, other primary care doctors, and other neurologists in particular more interested in this functional way of treating not only mental health but cognitive disorders. Okay, because I think the bigger problem right now is a lot of docs, like I said, just see volumes of patients and they're like, I hear that what you're doing sounds interesting and that it could be good, but it means I have to stop doing, what's lucrative. I have to stop doing what I'm used to doing to like figure new stuff out. And that the way of looking at it is, you know, the juice is just not worth the squeeze. I'd rather just keep doing what I'm doing because I have a full practice, I'm making good money. But if they can see success, if they can see excitement, I think that gets them to start asking questions about, am I doing enough, or what is it about this that I hadn't seen before, or that maybe I have to reconsider.
And if you were starting again tomorrow and you were building your practice up from scratch, what would you do differently, if anything, with everything that you now know? I know hindsight's a wonderful thing. I was curious to know what you might do differently.
So to be honest, I would the bigger thing I would do different is I would just make sure that I were branded as more like functional psychiatry and functional cognitive medicine. Um, because sometimes we get into the situation where patients come in and I talk to them about this stuff and they do tell me, like, I'm going to be honest, like, I'm happy that you think I should do this, but I just want you to give me pills. And again, it's nothing against this. I prescribe medicines to most of my patients, but it's not what I enjoy. So the challenge would be, trying to. There's a bunch of other psychiatrists that can do that, and focusing more on my energy into that whole functional space.
And thinking ahead for the next year or so, where would you like to be in 6, 12 months' time? I know the platforms are coming out, and that's going to be a big chunk of what you're going to be doing over the next year. But do you have any other particular aims or ambitions going forward?
So, of course, number one is getting the platform up and running, getting people subscribed, and having people, I'll use the word, know what it is and everything related to the platform. But the other thing I would really like to do is little by little incorporate more. I'll use the word. interventions that could be helpful for cognition and for brain health into my existing practice. And when I mean interventions, there are things that can be helpful. It's just some of them are expensive. They're just hard for someone to have in their own house. If there could be a place where these things could be readily available and patients could just come here, benefit from it without having to spend thousands of dollars on any of these devices or treatments, because we could spread the cost of this between, hundreds of people, that would be, I'll use the word like super exciting, and I would really just enjoy the having people coming in and out and seeing them take advantage of all this stuff. And a lot of this stuff is, I'll use the word straightforward and simple. Look, we know that saunas can be helpful for cognitive health. Um, some interesting literature coming out about, red light therapy, um, anything that helps people like relax and meditate, just providing educational stuff on healthy eating, but sometimes people just don't even know where to start. And having groups that focus on that, that focus on stretching, on exercise. A lot of my patients, can't go out and start running marathons. They're kind of chair yoga type of patients. But if you don't know where to go and learn about your yoga, it can just be like overwhelming to begin with. Because again, the 25-year-old can just go online and figure this out, but my 70-year-olds, a lot of them are just not that comfortable getting online and just clicking everything and sending messages from their phone. So having these services all in one place, I think would be like an amazing service to the community.
And with that, Ivan, I'd love to thank you so much for your time this afternoon. It's been such an inspiring and thoughtful conversation. I feel like I'm dealing with somebody in my world because we do very similar work, and it's very interesting to hear you sharing your experience about your approach and what you're building. So thank you very much, Ivan. Really appreciate it.
Thank you, Andrew. It's been a pleasure being here.